Good evening and welcome to the final day of CME Summit and Awards. I am Kamal Narayan, CEO of Integrated Health and Wellbeing Council, India's premier institution for health awareness, advocacy, and behavior change. In the past 2 days, we have discussed at length the positive impacts of continuing medical education on our healthcare delivery system. Also, we had the honor of recognizing the hard work of some of the most distinguished doctors from all over India for carrying the mantle of CME and saving lives even when the pandemic forced the world to halt. There is no doubt that as the doctors continue to learn about discoveries and inventions and enrich themselves with knowledge, the patients turn out to be the biggest beneficiaries, be it a more regular yet among the most critical care related to maternal and child health or other chronic or acute ailments, including diabetes, cardiovascular diseases, cancer, and even those related to liver or kidneys. The importance of continuing medical education, which some experts more appropriately term as the continuing medical enhancement, is immense in improvising the health outcomes for the patients. For ISW Council that believes in multidimensional contribution for better health of all, CME is like an invisible medicine. A better trained and up-to-date doctor, even at the remotest corner of the country, can treat its patients better, saving precious lives. And this becomes possible only when many of our veteran doctors passionately engage in enhancing the understanding and skills of their peers and juniors and ensure that medical excellence through continuing medical education as the mission of their lives. And one such personality who has made this as her labor of love and is with us to share her journey and experiences improvising women's health through training and skilling. So let me welcome Dr. Hema Divakar, CEO and Chairman of Asian Research and Training Institute for Skill Transfer Artist and also Foxy Ambassador for FIGO. Dr. Divakar is one of the most ardent advocates of women's health, is working with a vision to improve the healthcare services ecosystem for the welfare of women and children of our country. She is also instrumental in our mega mission for women's health, Sapat 1000 days, and she has been improving the women's health outcome of the country through large-scale training programs in partnership with several state governments. Over the last 3 decades, she has been a game changer in healthcare, establishing new benchmarks, standards, and touching women's lives in the process. So welcome, Dr. Hema Divakar, on this special program where we are celebrating the spirit of teaching, learning in the space of healthcare. How has been your experience and what motivated you to work more towards in the training space, which we have been seeing that has played a really remarkable role in improving the overall health outcomes or the access to quality healthcare to the women of our country?
Right. Namaskar and thank you, Kamalji and ISW Council yet again. And I love that you say CME Excellence Award because the pursuit towards excellence is the key to delivering quality in everything that you do. The passion and vision for doing better than the best has always been our mission. And when you talk about the training or the capacity building, I think it is the key element which bridges the gap between knowing and doing. Because innovations can be many, especially the Indian fertile mindset, if you may call it so. They come out with brilliant ideas, the jugards, and nobody in the world would have ever thought that in such a simple manner, so much can be done. But when the idea fructifies, who's going to do it? How they're going to do it? Where they're going to do it? Those become the barriers in implementation because in this large, complex country, every few miles, the entire context changes. And every few months, you will have a different scenario. So where we say on one hand that one shoe doesn't fit all, that is a given Western cliched saying, okay, which in the context of India is of course true. But just look at the innovation of the Indian fabrics. Sari, for example. One sari fits all. The size is limitless and the age is also limitless. It has a universal coverage and acceptance, just like the SDG goal. And same with the dhoti or the lungi. So which means that we are thinking out of the box. We are thinking how to make things happen in the simplest and the most feasible, most doable way. So from there came the idea that we should not make people think that everything is so overwhelming, everything is a rocket science, and everything we can't do in our context. We have to give them the confidence that yes, you can and yes, you will, and adapt it to the context and see what works where, and then try and get it off the ground. Because again, I want to compare the East meets West kind of a concept that we always run through our minds. One of the Western methodology is mapping, planning to the micro detail, and it takes time, 2 years before any project launches. And by that time, as I told you, the entire context and scenario is different. So we can't do that in our country. We have to just jump into action, learn our lessons as we go along. We may do better than what is expected. So broadly, plan your action, work your plan and plan your work and just move ahead. Keep making course correction alongside and move along, moving the needle, especially with all the angles that the healthcare scenario brings in, because you and me know very well that it's not only the technical expertise which counts, but it's also the gender lens, also the social fabric, also the access, also the affordability, also the access. There are so many things that comprehensively bring us together in trying to do our bit to change the healthcare ecosystem. So having given this long answer, to cut it short, to put it positively, looking back, moving forward, what did I do 2 decades ago? The dream is the same, reaching every girl, every woman, and trying to skill the available rich human resource. We want to look at the strength of our population very positively. Say, we have this rich human resource. Let's exploit them. Let's make them do what best they can. So 2 decades ago, when we started skilling people, we had to go on site. We had to go to the nooks and corners. And then the moment we turn our back, it's a short-lived. Behavior change is very difficult. Again, 3 months later, go and re-emphasize till it becomes a pattern. And it was exceedingly difficult to sustain and to scale. But we didn't give up. We said there has to be something happening. There has to be some methodology by it. So we kept on persistently and consistently developing the local teams who could take the initiative forward. But there is a lot that was, left to be desired, and some threads we couldn't pick up. We were very disappointed that the dream is big, 1 million healthcare providers we want to train. Why do we want such a big scale? Because there are 30 million deliveries happening in the country and we need at least 1 million. So the ratios and the numbers are simple to understand. So it was, in a way, we can very boldly tell it was a mega flop, because 1 million healthcare workers, you cannot go physically and, try to scale it up to that extent. But then when the digital technology started percolating into at least the metros about 10 years back, we picked up our threads again. We said, now let us explore this method. And very, very passionate about marrying the digital health, digital platform to the healthcare in every possible way. So we tied up with a lot of entrepreneurs and the startups, and we, again, how many times you fall, how many times you fail, but how you have the guts to pick yourself up again and move forward. That defines your strength. That defines your shapat or the resolve, according to me. Otherwise, it's just very superfluous. So when we started doing that, until last 4 years, okay, since she's, at it for such a long time. In fact, Omnicuris was one of the wonderful platforms. And I don't think at that point in time, many, many years ago, Savita couldn't found anybody as passionate as I was. So I was the first person to tie up with the wing of women's healthcare and the OBGYN initiatives. And then it was Tata Cancer, which tied up for the oncology. And then we moved further. We did about 200 digital exchange programs way back. And we knew that many were not actually seeing it or doing anything with it, but we didn't care. We went ahead and went on hammering it. Then the online courses came, and then the fast track courses, and it was so user friendly, and people could sit at their doorstep. And slowly they began moving into our world of the digital connect, and then all the programs which we had left behind decades ago were picked up again. And today, Manyata, which is one of the biggest flagship programs, is the last 9 years in Foxy. Last 4 years, from artists, we were training them digitally. And it was a 90% of the leadership said, no, we cannot skill people. We cannot skill transfer on a digital platform. We did the videos, we did the simulations, we did interactive sessions. We were very confident this was going because all the centers which we had trained got nearly 100% marks. So they said, what is her recipe? How did this happen? How could this happen? They were just left wondering, but they did not open their minds that they too can do it. And then, lo and behold, COVID-19. Thank you very much, I said to the pandemic, because everybody had to jump onto the digital platform, and each one of them, if you don't try it out, if you don't dare to experiment, if you don't dare to experience, you will be stuck where you are. So they all were forced to plunge into it and swim up in a way. Now we took the feedback of the skill transfer initiatives by the entire leadership, and 98% of them today opine that yes, this is the best way forward. We can do better, we can do more. Oh wow, this is like really a good thing to happen. And the catalytic effect by the COVID-19 was one of our best winning points, or the trump cards, so as to say. So the skill transfer courses seamlessly we are running each day, each month. Short courses, long courses, refresher training, and interactive session, the master classes, smaller groups, larger groups, and certification courses, and everything is happening in a very intense and a seamless manner. And I think we are learning from our own experience to give a better learning experience to our audience. And I think that though we know that hybrid, because not everything about everything is going to be good all the time. We do miss our physical meetings. We confess, we agree on that. But in reality, it's a mix of everything to give you the optimal end result that matters. And I do think that with the digital platform becoming available to us, sitting in one corner of the city of Bengaluru, we are able to reach pan-India, pan-Asia, pan-global, and it has been a very, very exciting and enriching experience, so to say. So that is the long story which I couldn't cut it short. You're muted.
Yeah. Sorry. This happens with me also sometimes. Okay. So, no, Dr. Diwakar, it's not a long story at all. It's very well, I think, recaptured. And you kind of, from the beginning to the challenges faced, and then how you continued your, whole mission of imparting training to as many people as possible. And you're saying at least 10 millions are needed. 1 million or 10 million?
1 million, at least 1 million. That's a start point.
Yeah, 1 million is needed at least, because especially in the women and child health space, 30 million deliveries happening every year. So we need to have that kind of support system. Just to kind of get some more outline of your massive work which you have been doing. What has been the number you have reached out in terms of doctors being trained, or paramedics being trained, or other nurses, ASHA, A&M? I think you have been kind of work you were doing multi-states. What has been the number so far achieved in this duration?
I think with the skill transfer program for safe delivery, we've reached 14 states so far, starting right from Himachal Pradesh to Ludhiana to Madhya Pradesh, and interiors of tribal areas like Ratlam, and down south Tamil Nadu, Karnataka, and many western interior parts of Maharashtra, Bihar as well. So it's a very wide network. The only constraint we had in the skill transfer for the paramedics is the language, because each region, as I said, that's a special challenge in our country, because all the learning management resource platforms, they give the English version and it doesn't work with our staff. So we have batches as per the language: Kannada batch, Tamil batch, Hindi batch, Marathi batch, like that, because that is the kind of, even Assam, though they can understand Hindi, we had a local SMEs champion who would quickly interpret and again revise the same thing in their own language, which makes a lot of impact on their learning process. So in terms of numbers, the team buildings of various hospitals, the total numbers as of now are 27,500 plus, somewhere there, but we still have a long way to go. But the collaborative efforts, the cascading effort, the ripple effect has now enhanced, and I think we will be very easily now able to reach the goal of 1 million for sure. But that's not enough. We need to do more. That was the first basic ballpark figure we had laid out, and we need to expand on our courses as well. As far as the doctors are concerned, the certification courses, where we make sure they know what they're seeing and learning, that is about, we have launched the certification courses in about 8 different OBGYN topics, and we have about, definitely the minimum number is 10,000 numbers of doctors per course. And, for example, a course on thyroid disease, there are 400 OBGYNs in Nepal. Each one of them have taken the course. So it has gone beyond the boundaries, geographic boundaries of India, and we were very surprised that they're so looking forward. So now African region and Asian region, we have expanded the base of the doctors learning on our courses. And very recently, we've started what's called a masterclass, which is again another modality. See, because in a big webinar, where we have 2,000, 3,000 attendees. Of course, a couple of them will ask the questions, but it is not so interactive. So we have now devised an intense course where a select about 80 people are taken and 4 breakout rooms, so 20 each. So each one is led by an expert, and they have immense scope for interaction, asking their questions, making notes, and the challenging cases are discussed, and they all come back to the common room, 80 of them. It's very engaging for them because each one of them has to make a presentation then and there live based on what they have discussed. So they are very keenly paying attention to that, and it's a healthy competition. They're all on the same screen, so it's very exciting for them to deliberate and see the pluses and minuses of each other's thought process and experiences. So this has, I think, again, another novel way of disseminating, which is working, because it is better than a classroom, because there's a small segments, and the nationwide stars or experts are available to them at their doorstep, which is, such a low cost, but a highly effective way of deliberation. And then there was one key point that ISW Council had raised with the Omnicuris about the crosstalks, about one specialty and another specialty meeting together on a common forum and trying to discuss something. Again, let me go back to the year 2000, where I launched a program called Towards the Next Millennium. Okay. And the concept of that program was that we as gynecologists, the closest specialty to us is pediatricians, because woman is pregnant, the child will be born. So we will need a children's specialist to be in our team for sure. But what was happening back then, and many times even now, is that we talk to the women in pregnancy and soon after delivery as well. Pediatrician talks to the same women, but we don't talk to each other. The gynecologists and pediatricians are not talking. The crosstalk is not happening. So what he is telling or what we are telling, it's all such a connect but disconnect. So at that point in time, I said, no, we have to have gynecological meetings where pediatricians will attend, pediatrics meeting where gynecologists will attend, and we have to crosstalk and disseminate in a common platform and a common forum what best we can do. But again, coming to the fact that 1 or 2 programs went very well, but all the gynects thought, who will listen to these pediatricians? We are spending so much time, so much energy, so much effort. The subject is not directly related to us, and we're not anyway going to do. So only the faculty which we called used to come and participate. The audience was, hardly ever there. So slowly it fizzled out. Whereas now what has happened?
Do you see that as a major challenge? Because what we believe in ISW Council also is that we need to break these silos of specialties, and because you can't separate a child from a mother health.
Absolutely. So that is the closest connect, as you have imagined. So even that was not happening in the physical meetings. And then osteoconnect. That means bone health of girls, women. Again, we needed the orthopedic. Diabetes in pregnancy. We needed diabetologists and the gynecologists to come on a common platform. But somehow, always to my mind, it was suboptimal. But again, this is a COVID connect, because that is impacting all age groups, all specialties. Everybody needs to know about it. Now we are very, very, very eager to come on the same platform, understood the holistic approach, understood that each one has to talk to each other, not only the cross specialities as in the different medical specialities, but I must again re-emphasize that forums like IHW Council has brought us in touch with cross-section of the key stakeholders, which together will have to work towards making a difference. That is where the breaking of the silos comes in, Kamalji, where whether it's a social marketing segment or whether it is a CME segment, whether it's good air, good water segment, whether it is public health, whether it's politicians, whether it is NGOs, whether it's any segment which have a vision of doing their bit, but can they do it alone? Can they do it in a silos? And we figured out that this is why we are failing, because we have not connected. And I must re-congratulate you, as how I've done many, many times before, that this has given a very, very good, inspiring incentive to all of us, that it's easy to connect. There is some catalyst in the form of Kamal and the IHW Council, which is bringing us together. Let's make use of these connects to work with some synergistic effect, and really already we are seeing the impact of Shapath, where the resolve of 1,000-day journey to do more for women and children's health, with all the collaborators that we are connected with, each one is making a very significant impact on the mission that we are now all set to take forward. So thank you again for that.
It's very kind of you, Dr. Divakar, that you are appreciating our role, but it is more of doctors like you and experts like many others who are contributing immensely in this area. And there are so many organizations, and even the government of India and state governments are also extremely willing to work in this space and kind of improvise the overall health outcome. I'll just take 2 more minutes and try to understand from you that you mentioned about the pandemic catalyst, and also how the pandemic changed the whole scenario and made acceptance of the digital medium of skilling, learning, training much more, I think, acceptable, whether it is willingly or not. But it has become the way of life from children to, I think, the professionals like us, and for all mode of such communications. Women health has been a space where there is a lot of heterogeneity in terms of the quality of health across the country and the skilling of the people, and you were trying to fill this gap across the country in multiple states. And when the COVID-19 came, obviously one of the major I think which is already a big burden, like for example in women health you have the challenges like this, which will look like a more doesn't sound like the challenge of a modern India. 50% of our women having being anemic, something so simple to be addressed, I believe, and still we are having every second women suffering from that. So those are the major challenges in the space of women and child health, and we know about the malnutrition problem of the children and all that. So in this space, how did you kind of in a COVID time when it was become even more difficult to ensure a better quality of the health, because the training is not possible, and then you need an additional need of kind of skilling and training people to also become I think prepared to tackle the COVID interference also. How has been your experience? If I can quickly take a couple of more minutes.
Yeah, right. Another 2 minutes, I think, because all are very distinguished speakers, panelists, awardees, all. I can see them on the screen, and advance congratulations to all of you. Kamalji, one little point about anemia care. The whole approach has now changed in the last 3-4 years, because the Poshan Abhiyan, the Anemia Mukta Bharat Abhiyan, the PMSMA, everything have kind of joined hands together to see a life course approach and the connect between what happens in the womb to the NCDs, the generation next. So all these are now beginning to get recognized and realized that we absolutely cannot work in silos. And the recent program on Anemia Mukta Bharat, T3, test, treat and talk. Nobody was even talking about it, with just prescribing the medicines which patient may never take. So everything came together, and now in our courses, we not only have the technical teaching to the staff and the teams, but we also have a module on communications. We have a module on time management and stress management, and the infection prevention control, which has come in a big way. And there are a lot of additional buffers into this to make it not only holistic, but the culture of actually changing something so strong as their behavior has been the focus. Because if they are motivated enough, and if they recognize the self-worth that they are making a difference, with that kind of a dissemination of the skills and the knowledge, I think that has been a very significant game changer, because they all got into the mindset during COVID-19 pandemic that we need to contribute, we need to give back, we need to do something that we can. So that humanitarian approach, the humane approach started, escalating, and we encashed on that and the digital platforms and made things happen in a very significant and a positive way. Not that, we said that you and me know that the journey is long, but it has to begin with one step, and we have taken more than one step towards that. So we are very optimistic, very positive that this era has helped us change everybody's mindset towards preventing illness and promoting wellness people are even, at least, they're in the mindset of listening and taking care and not saying that let's see when the time comes. They're prepared and they are cautious, and that is a big leap forward to help us to do our best.
Thank you so much, Dr. Divakar, for your very insightful, deliberations and sharing this whole journey. We have now reached to the most awaited segment of our program, and it's a third day of our CME Excellence Movement Culmination Week. So I can see a galaxy of very important and esteemed doctors with us, and also our guest of honor for the evening, Sri Hiralal ji is also.
Namaste, Hiralal ji.
So thank you so much, Hiralal ji, for your kind time and support, and I'm sure that your presence is going to encourage all our awardees of the evening, and will help me make them achieve more, do more for the health of the society, for the health of our country. So now I pass on the charge of this program to my colleague and the host of this program, Anisha Nayyar Dhawan, to take it forward. Anisha, over to you to begin this important award ceremony.
Thank you very much. Namaskar.
Thank you, Dr. Divakar. Thank you so much.
Thank you, and good evening, ladies and gentlemen. I'm Anisha Nayyar Dhawan, and this is an absolute honor and pleasure for me to be present here on the last day of the second edition of the CME Excellence Awards presented by Omnicuris, India's largest online CME platform, and conceptualized and organized by the Integrated Health and Wellbeing Council. IEEE Council is a not-for-profit organization aligned with the holistic approach of the UN's Sustainable Development Goals and dedicated towards creating a positive synergy among people through advocacy, accountable actions, and call to action to maintain a healthy and positive state of mind to make well-being a permanent status in life. It is our extreme pleasure and privilege to constitute and organize such rewarding initiatives to highlight and promote the outstanding contribution of doctors and medical professionals engaged in continuing medical education and helping in maintaining competency, improving clinical performance, treatment, and quality of healthcare. Let's first see this video on CME Excellence.
सभी एक दूसरे की पीड़ा को अपनी पीड़ा समझ करके पीड़ित मानवता के लिए वो आगे हाथ बढ़ाएं, यही हमारे मानवीय गुण है.
Continuing medical education doesn't mean that you should be collecting doctors. Everyone has to read. Self-learning is the best way of learning.
We at ISW Council, in partnership with Omnicuris, have transformed our humble initiative that began in 2019, the CME Excellence Summit and Awards, for supporting, encouraging, and celebrating role of and contribution of CMEs into a full-fledged long-term national movement this year.
4 ingredients for the recipe of this excellence in the CME platform, I would think, is mainly, as you said, the knowledge share, everybody knows. The second important thing is the skill. The third is the attitude, and the fourth is the wisdom.
Doing CMEs, which are in fact the backbone of quality assurances that many of the hospitals are looking to improve the care by refining the physician skills.
The aim of CME should not be the dispersion of a knowledge only. It's very important, besides empowering the people who are listening.
The CME Excellence Movement, a 5-month-long knowledge-sharing and learning movement, witnessed key experts, doctors, KOLs, government officials, and influencers highlight the importance of continuing medical education and also discussing various challenges associated with it. Now, the mega movement is supported by the Association of Physicians of India, the Federation of Obstetrics and Gynecological Societies of India, FOGSI, and the Indian Society of Gastroenterology. We would like to thank all of you from the bottom of our heart who have wholeheartedly supported this initiative by being present here today. To begin with, I'll call on CEO ISW Council Kamal Narayan to say a few words.
Thank you so much, Anisha. So our guest of honor, Dr. Hira Lalji, IAS Additional Mission Director of National Health Mission at Uttar Pradesh, who has in his around 3 decades of services been focusing on bringing grassroots level transformation, and is also a staunch believer of preventive health and well-being. So I would like to extend our hearty welcome to him first, and also our partner in this initiative, Ms. Savita Kuttan, CEO and co-founder of Omnicuris, India's leading digital and medical education platform. Our esteemed speakers of the day and acclaimed and highly respected healthcare professionals from across the specialties and the nation. Thank you so much, and good evening to all of you. I welcome you all to this special occasion of CME Excellence Summit and Awards. I'm happy to see that the 5-month-long endeavor of CME Excellence movement has finally reached to this concluding leg, where we are celebrating the exemplary and remarkable contribution of medical experts in this area. And as we all know, CME is essential for both the professional development of clinicians and enhancing the health outcomes of the patients. But we believe that this is also very impactful and important way of bridging the human resource shortage in the medical sector of our country. And not only this, it will also help identify many diseases early, which will ultimately help reduce both the physical, emotional, and even financial sufferings of our patients. For a country like India, where so many people suffer and lose lives due to diseases like diabetes, cancer, strokes, heart problems, and even many more related to liver or kidneys, CME certainly is the most critical tool that can help change this scenario through early diagnosis and effective care. It actually works like an invisible medicine. That's how we believe it. And we have seen how CME has helped us prepare our medical workforce in the fight against COVID-19 as well. And the role of CME or the imparting training to doctors across the country at the front line has been so immense in ensuring that we can put up an effective fight against the virus. We began this CME movement in 2019 along with our partner Omnicuris to underline the role of CME and facilitate them further, and also to recognize the efforts of all those who have been putting their sincere efforts in it. And this award ceremony today is an attempt at honoring the best minds in the Indian medical fraternity who have made exceptional efforts in this direction. And I'm honored to have so many great and inspirational icons of medical field with us today. And I welcome all of you once again, and also place my sincere gratitude to all of you for your outstanding contribution to the health of the people of our country. Thank you so much for being with us today. Over to you, Anisha. Thank you.
Thank you, Kamal. Now I would like to invite Ms. Savita Kuttan, CEO Omnicuris. Please say a few words.
Thank you, Anisha. A very warm welcome to all the dignitaries who are visible today. As Kamal mentioned, today is the 3rd day after a 5-month-long initiative that we started for this year. And this is the 2nd edition of the CME Excellence Awards and Summit. The first one was physically held in Delhi. did not want the pandemic to affect this event, and hence we had made a 5-month-long event wherein we had seen a culmination of a lot of different experts across multiple specialties come together. There has been a lot of deliberations on the policy-related aspects of continuous professional development, starting from the regulators to various medical associations to various experts who have come together. Today is the closing day and the third day of the recognition and awards ceremony, and a very, very warm welcome to all of you. I'm not going to speak a lot about CME and CPD. All of you are the storehouse of our experts who have been doing this all your life as teachers and experts. Just a few words on how the whole continuous professional development is evolved in light of the COVID pandemic. It has come up with a renewed interest for doctors and clinicians and other healthcare providers to be able to get information, reliable and updated information on their fingertips. It has evolved from not just knowledge acquisition, but with more emphasis on knowledge management and upgradation, because the COVID pandemic has really placed a very unique challenge for the doctors of today. Now, a lot has been done by the regulators, various CME providers, medical associations in India, and various other experts. However, we at Omnicuris believe that India as a country still needs to evolve quite a lot in terms of making the process of continuous professional development in a more streamlined and more effective manner. And we've been constantly working with the regulators and governments to be able to implement it. This event, ladies and gentlemen, is a very humble initiative with two prone objectives in mind. The first one being to emphasize the importance of continuous learning and continuous development for the healthcare professionals as a whole, not just clinicians, but all the team of healthcare workers, including nurses, including technicians, paramedics, and all of them. So that's the first objective, to bring in the advocacy and awareness. The second one is to recognize, acknowledge the significant contribution made by the experts and KOLs in this field. Without their help and support, there is absolutely no way that the continuous professional development can evolve. So these are the two objectives of this event. This event and recognition, we very well understand, is no match to the time and effort which has been put in by all of you all experts who have gathered in here. But this is a very small way of recognizing the efforts and the time and your energy which is being put here. Some of the faces when I see here, I feel very happy that we started our initiative about 4 years back. We have our Dr. Hema Divakar, CEO of Artists. I still remember Dr. Nikhil Tandon with the conversations we had with you in the AIMS office about continuous professional development. We've got Rajan here from the All India Ophthalmology Society, Dr. Upender Kaul, who has been a very, very solid supporter of cardiology, continuous professional development, and has done significant work in that. And today we are here to be able to reflect about all of those efforts which has happened in the past, and to bring together all of you is really an honor for us. Very quickly, I would also like to thank the 4,000 plus medical experts who have contributed to Omnicuris over the last 4 years. And across 40 different specialities, with their support, we have been able to reach today to 280,000 doctors across over 250 districts in the country, some even to the remotest part of the country, which has never seen any kind of a digital technology. We are thankful to over 120 medical associations that we have partnered with across 40 plus specialities again. We're thankful to AIC, Atal Incubation Center, Niti Aayog, who's our supporter in this mission, who has extensively guided, supported us, incubated us in this process. Over 20 different medical councils across the country who have stepped up in terms of the regulatory activities and streamlining of regulatory activities, working with Omnicuris in the field of continuous professional development. We're thankful to Ministry of Health and Family Welfare for the support and the confidence they have placed in us across various initiatives, starting from cancer to COVID to diabetes and many more that they've been partnering with us in doing, as well as the newly formed National Medical Commission. Last but not the least, we're thankful to the prestigious medical universities. Some of them had assembled yesterday, starting from AIIMS New Delhi to CMC Vellore to Tata Memorial Center in Mumbai and many more. I really thank all of you today, and I look forward to an excellent evening of our closing day ceremony of the second edition of CME Excellence Awards and Summit. Without much ado, I'm going to pass on the baton to Anisha for thank you very much.
Thank you, Savita ma'am, for your address. Doing all of this basically has really helped us climb over many of those divides that COVID had brought over. Now, I would request Dr. Hira Lal, IAS Additional Mission Director, National Health Mission, Government of Uttar Pradesh, to please say a few words. Dr. Hira Lal has a rich experience for 26 years as a civil servant, and he has served in various departments in different capacities. His last posting was District Magistrate in Banda. Thank you so much for being here, Dr. Lal. Please say a few words of encouragement to all the experts and the doctors who gathered here. Dr. Lal, request you to please unmute yourself.
Okay. First of all, I will like to welcome all the participants and particularly IHW Council, who is organizing in association with other partners. This year event is a concluding journey of 5 months. Indeed, very good work. I was studying your site, IHW Council. So I saw you are doing so many programs. I, as a district magistrate, I, as a chief development officer, found very difficult to implement the things on the ground. But you people, small in number, with very small resources, as I know, are doing very amazing work. And really, I was impressed with your Kamal ji CEO. I had a very small discussion a few days ago. I tried to know him, what you are doing, why you started. So after discussion, I came to know that he is having a very diverse experience at diverse locations in diverse organizations, and that's why he is enriched in doing amazing works. Coming together, sharing knowledge is the best approach, which is the motto of continuing medical education. I was thinking why continuing medical education CME name is given to this, meaning thereby it is said doctors, engineers and lawyers keep continuing reading, writing till 2 a.m. in the night. Doctors, engineers and lawyers are needed to read, write, get educated continuously in order to update himself, know all the relevant and ongoing knowledge in order to perform the services required as per the demand. During the Corona period, bringing medical experts, not nationally but globally, together in groups to provide the services in different modes is the work you people have done in the last 5 months, which is there is no single word I can sum up this amazing work. So I would request one more thing. IHW can make a model in a district. You please associate with one district magistrate. There are 739 districts in India. please find one district and associate with one district's administration and try to implement all your knowledge in a district to create a model. And once it will be done, that model can be replicated all over India. That is a big market and it is very easy to do. You need to focus your this work in a district. And if you will try, I am hopeful, I am sure that you will get some districts who will collaborate with you and work in tandem. So that is my request, and I do have some plan in my mind, and I will discuss you later on how to get it done. For awardee, I will like to again congratulate you, because in one meeting I had said award encourages, inspires equally, whether he is a kid or a expert or a IS officer. So giving award, recognizing good thing is a motivation not only to a person who is going to get the award, but for the whole institutions. I would like to share my one example. I was running a scheme as a district magistrate in Bada. That was the water conservation, and we got one award. By the way, due to some problem, I could not participate in getting that ceremony, in getting award. I sent someone on my behalf. When she came back with the award, the speed of all the stakeholders of that scheme was increased, motivated, and the result which we would have got in 2 years, we got in 6 months. So award is having a strong impact on whole team, not only a single person. So this is a good thing, though award is a certificate, but it is having too much weight, too much value, which cannot be monetized. So with this, thank you for inviting me over here. And again, I would like to request you, please make a model with your expertise and associations, so that we can replicate it in whole India. Thank you, Anisha ji.
Thank you so much, sir, for your encouraging word, and we will definitely try to implement what you have suggested, and we will take the discussion forward. Thank you so much.
Omnicuris, leveraging the power of technology to bring the best medical expertise under a single platform, first time ever in India. Omnicuris brings online CME credit points, approved by the Medical Council by forming a mighty convergence of over 150 bodies, prestigious medical associations, premium medical institutes, and state governments, all under a single platform, to share India's best medical expertise in the click of a button. Today, Omnicuris is India's largest online platform, supported by the Indian government's flagship mission, the Atal Innovation Mission, and works hand in hand with the Niti Aayog in training healthcare professionals across aspirational districts. Omnicuris successfully trained 112 districts and over 9,246 doctors in the span of 6 months during the first COVID peak. Omnicuris over the years victoriously collaborated with 150 plus associations to create CME programs pertaining to across 47 plus specialties. While benefiting doctors with credit points through online CME programs, Omnicuris also hosts live talk shows with stalwarts from the medical fraternity and digital conferences that can be accessed anytime, anywhere with a click of a button. Omnicuris.com, India's largest online digital platform for doctors. Improving quality of care together.
So definitely thumbs up to Omnicuris, that is bringing so many renowned doctors on the same platform. Now, without further ado, let's begin the proceedings of the second CME Excellence Awards. We would like to start with the CME Excellence Category Awards. And the first one is the CME Excellence Leadership Award organization presented to Indian Medical Association. Heartiest congratulations to Dr. J.A. Jayalal, National President, Indian Medical Association. I would request Mr. Jayalal, if he's present, to please say a few words.
Thank you very much, Omnicuris, and thank you for recognizing the services. We appreciate the good effort, good works have been done by you. I know in this corona pandemic, and what the best service we can do to the country is only updating the skill and knowledge to the people who are treating it. In spreading and propagation of the message of the good information to the is the most important service which we are doing. I'm happy I have been able to participate in a few of your programs, and it is really good. Indian Medical Association always trying to do this at all our level to make a uniform knowledge propagation throughout the country. We appreciate and we will compliment all the good works done by all those who are involved in this good work. So we would like to thank you for the good works you are doing on the CME board, and equally I'm looking forward that many things we can do for the establishment of common protocol, common knowledge to the people, because we know that whenever a doctor is coming out of a medical college, he learns the basics, but what he is coming out, there are much more than the science. He has to know about ethical, legal, moral, and also the political inclination to the science. So that can be definitely been put forward by these continuing medical education programs, and we are working on that. I thank once again all those who are involved in this project. Thank you for doing this work for a long time.
Anisha, one point I would like to highlight here, with IMA, Dr. Jailal, under your leadership, significant programs that we have done targeted not just to the IMA members, but even the cross-functional specialty discussions, which has really gained a lot of popularity over a period of time. And particularly the point that you had mentioned about not just CME, but the holistic education, which includes medical legal, which includes leadership, and all the other aspects that IMA is focused on. So really proud to work with you, and we continue to look for a lot of such programs to reach out to even further and remotest part of the country, more to speak. Thank you, Doctor, for all your contributions, and congratulations again.
Congratulations, Dr. Jayalal. Now, the CME Excellence Global Icon of the Year Award is presented to Dr. Upendra Kaul, Chairman, Batra Heart Center and Dean Academics and Clinical Research, Batra Hospital and Medical Research Center, New Delhi. Congratulations to Dr. Kaul. I'd request you to please say a few words and share your thoughts. I think Dr. Kaul would request you to please unmute yourself. Dr. Kaul is on the call here. He's with us, but I think he is not able to connect with us. So I'm going to move on to the next award. The CME Excellence Distinguished Faculty Award is presented to Dr. Nikhil Tandon, HOD, Endocrinology, Metabolism and Diabetes, All India Institute of Medical Sciences. Please put your hands together to congratulate Dr. Tandon. Dr. Tandon, I request you to please say a few words.
Thank you, Anisha. It's both humbled and privileged to be nominated for this award and to be included in this list of very distinguished health professionals. As a passionate academic and teacher, I think the biggest privilege is the opportunity to share knowledge with peers and students alike. And in that, on top of that, to get an award for the same thing really increases the privilege to a very, very large extent. Medical education, as Mr. Hiralal mentioned, can be very daunting. The quantum of knowledge required becomes more, and the expectations of peers and patients that the doctor should be not only very knowledgeable, but is in a position to translate that knowledge is increasing day by day. And I think CMEs are an incredibly important solution to that problem. On this particular aspect, the pandemic actually ended up creating a significant challenge to knowledge dissemination, which I think IT and digital platforms have really done a great job in filling in. And we've embraced this, and I think this has done an incredibly good job, so much so that I find that I've done perhaps more CMEs in the last year than I've done in any other year before that. I'd like to once again put on record my gratitude to the Integrated Health and Wellness Council and Omnicuris for considering me, and also to endorse their activities for continuing to spread medical knowledge through innovative strategies. Thank you so much.
Heartiest congratulations, sir. Let's now move on.
So Anisha, just one mention here very quickly. So Dr. Tandon, yesterday we had another session where some of them mentioned that 30 to 40% of patients that a CP or a GP would meet are diabetic patients. So in that context, the kind of course that you put together for GPs, the format of delivery, which kind of made it very simple, and coming from an institution, from a leader, such a way that the entire module was very simple for the GPs, and that led to the whole course of diabetes for GPs to over 8,500 GPs across the country, especially in the government setup. Achievement there, Dr. Tandon, and we look forward to more such initiatives from you. Thank you and congratulations.
Thank you.
Congratulations, Dr. Tandon. We are very privileged to have with us Dr. Kaul, who has now joined us. Dr. Kaul has won the CME Excellence Distinguished. I'll just go over.
Thank you very much for considering me for this important event, and also to give me this award. And I cherish all the honor bestowed on me, and I promise that I continue to be continuing with your continuing medical education program, which is so good. And I always like to teach. I've been a teacher for the last, I think, 30 years. So once again, all the best, and whatever I can do to promote Omnicure and its mission, I'm always there. Thank you very much.
Thank you, Dr. Kaul, for your presence, and thank you for joining us here. Let's now move on to the next award category. This is a CME Excellence Voyager Award Individual, which is presented to Dr. Rishikesh Pai, Founder and Managing Director, Bloom IVF India, and President-elect Foxy. Please put your hands together to congratulate Dr. Pai. And Dr. Pai, I request you to please say a few words.
Thank you very much. I must thank Savita. I remember when I was Secretary General of the Federation, and my better half Rishma was the Foxy president. She approached us and we started the academic activity. And obviously in the COVID times, it has culminated. And I look forward, because I'm becoming the president of the Federation, which is the second largest federation of the country. And I feel that we need to integrate knowledge. We need to also widen it into other three areas of profession, that is fellowship, CSR, and professional development. These are the four pillars. Academics is just one part of the whole picture. And then I also feel that there's a lot of disconnect between the various organizations. I've always told Mr. Jaya Lal that the IMA is the mother body, and we are all the 3-4 important. Of course, all the other bodies are important, but the API, the ASI, the IAP, and the FOXY and the IMA together, we had started the FOMA, and we must integrate medical education. We must integrate symptomatology. There's too much diverse. Everyone, if you have a symptom, everyone will treat it differently. Why can't we have the same consistency in treatment? So we are lacking somewhere. So we must work with the Central Medical Council, whatever, and come to a integrated solution. So that is my fervent request to all of you. And thanks a lot again for this award.
Dr. Rishikesh Pai, not to mention your enthusiasm all through the last many years that we've been able to collectively reach over 34,000 gynecologists in the country. And, with the innovation that you put together, some of the Foxy members we have observed as one of the most enthusiastic members across various other medical associations. Thank you so much for all the efforts, and we look forward, and congratulations once again.
Thank you.
Congratulations, Dr. Pai. The CME Champion Education Award is presented to Dr. Sanjeev Thomas, Assistant Professor of Neurology, Department of Neurology, Sri Charita Tirunal Institute for Medical Sciences and Technology, Trivandrum. Heartiest congratulations to Dr. Thomas. So please say a few words and share your thoughts.
Thank you for the award. It's indeed an honor from the IHW and Omnicuris to allow me to participate in the CMEs and contribute to the continuing medical education in India. In this time of COVID pandemic, you have done a tremendous job by organizing excellent programs, and the content was received well by all the participants, as I read from the responses from the participants. It was my pleasure to be involved in it, and I appreciate the honor, and indeed it will be a stimulus for us to work harder and also do more work in this line in future. I would also like to thank all the organizers who worked behind this steadfastly to organize the program so well. Thank you very much.
Congratulations, Dr. Thomas. The next award is the CME Excellence Leadership Award presented to Dr. V.G. Mohan, gastroenterologist, hepatologist, and therapeutic endoscopist and founder and chairman, VGM Gastro Center, Coimbatore. Please put your hands together to congratulate Dr. Mohan, and I'd request Dr. Mohan to please say a few words to all his peers here.
I'm very grateful to Omnicuris for selecting me also for this award. And we have done through VGM Foundation a lot of webinars in the past 1 year. And I've worked closely with the Indian Medical Association, with Indian Society of Gastroenterology, SGI, the Obstetric Society of India, and whatnot. So I've given multiple lectures, and Omnicuris has always been a great platform. I just loved the Omnicuris. They've done remarkable work in the field. And as a past president of the Indian Society of Gastroenterology and Endoscopy Society of India, so it's always a pleasure to teach all the youngsters, which I've been doing for the past 34 years. But I think the COVID has brought us all together, right on the virtual platform, with no need to run around to places, because those days, every weekend, I used to be traveling to some corner of the globe. But right now, everything is done from my office here. So that is, in one way, it's bad, in one way, it's good. So we could educate more people. So I'm very grateful to Omnicuris. I'm really humbled by this honor that you have done to me and the VGM Foundation. So I'm so grateful to you. And God bless Omnicuris. I'll be so happy to associate with you in future, all your future endeavors. We continue to do more programs, and even for the postgraduates, national postgraduates in the field of gastroenterology, we are doing a program called SAGE through sageacademy.in. So this is a 4-year program with 96 lectures over 4 years. Already we have crossed 8 months. So we're just continuing carrying the torch of education, because that is a way to reach out to more and more doctors in the medical fraternity, so that ultimately the patients can get cured of their illnesses in the best possible way. I'm very grateful once again. Thank you so much.
Thank you, Dr. Mohan, and congratulations to you. We would now like to start with the Dronacharya Awards, which salute the spirit of passing on the knowledge to other practitioners to improve their understanding of the subject matter and to help them provide better healthcare to patients. In rabies treatment, the CME Excellence Dronacharya Award is presented to Dr. M.K. Sudarshan, Founder, President and Mentor, APCRI and Rabies in Asia Foundation Rabies Specialist for exceptional CME efforts in rabies treatment. Please congratulate Dr. Sudarshan, and Dr. Sudarshan, would you please say a few words on this occasion?
Yeah, thank you very much, Ms. Anisha Nair Dhawan, for introducing me and also telling a few words about the award. And actually, it has come as a surprise to me how I was chosen, and because it all happened in just 2-3 days. And now I understand that it is from the APCRI, the Association for Prevention and Control of Rabies in India, which is spearheading the CMA program movement for rabies prophylaxis in the country. And I take this opportunity on behalf of APCRI to thank IHW and also the Omnicuris for choosing me and also recognizing APCRI for this award, and I thank everyone here for the felicitation. Namaste. Namaste.
Congratulations.
Yeah.
The CME Excellence Dronacharya Award is presented to Dr. Ashwath Narayan, President, Association for Prevention and Control of Rabies in India, for exceptional CME efforts in rabies treatment. Please put your hands together to congratulate Dr. Narayan, and Dr. Narayan, please say a few words and share your thoughts.
Good evening to all of you. I thank IHWC for recognizing me for this award and also recognizing Association for Prevention and Control of Rabies in India. We are spearheading prevention and control of rabies in the country. We could able to reach out to hundreds and thousands of medical professionals and veterinary professionals in the country for preventing this deadly disease, rabies. And we worked in collaboration with the various state governments and also with the National Focal Point, National Center for Disease Control, for strengthening the rabies control program in the country. So once again, I thank IHWC and Omnicuris for very cost-effective CME programs conducted across the country during this COVID pandemic. So thank you very much.
Congratulations. The CME Excellence Dronacharya Award is presented to Dr. Sumit Poddar, General Secretary, Association for Prevention and Control of Rabies in India, for exceptional CME efforts in rabies. Congratulations, Dr. Poddar. Please go ahead and say a few words to your peers.
Good afternoon. Actually, thank you very much for recognizing us in this platform. The main thing is that we are working all together with the Association for the Prevention and Control of Rabies in India. Usually it was established in the year of 1998. And after that, we are running behind, at least for one issues are there, that is a rabies-free country by 2030. That is our target. And to achieve that goal or target, what we are doing, actually we are setting many CMEs throughout the country and nationally or internationally. As well as also, I am also working in the field of Rotary International as the chairman of disaster management and the chairman of rabies control. That is a thing, actually it is our dream that by 2030 will be, by everybody's effort, will be possible to at least control the rabies, at least from the country, so that each and everyone will be beneficial. Number one thing is very much needed, that is awareness program is also very much needed, particularly in school-going children, particularly in all sectors. But the children are the commonest victim, so we'll have to look on them. So this is our dream, this is our passion, whatever you call. And for this, we are continuing many CMEs. In fact, we are also having a CME today also in the evening. That is the thing. Thank you, madam, and also selecting us with these highly sophisticated persons like Professor Sudarshan and Dr. Ashwat Narayan. Also, I am at present as the Secretary General. Ashwat Narayan is the President of APCRI. And also Dr. Sudarshan is the mentor and the founder president of our Association for the Prevention and Control of Rabies in India. Thank you very much. Yes, thank
Congratulations, Dr. Poddar. The CME Excellence Awards in Endocrinology, the Dronacharya Award, is presented to Dr. Sujay Ghosh, diabetologist and endocrinologist, Department of Endocrinology, Institute of Postgraduate Medical Education and Research, Kolkata, for exceptional CME efforts in endocrinology. Congratulations to you, Dr. Ghosh. How do you feel? Do share feelings with your peers here.
Thank you so much for the kind appreciation and for the recognition that you have given us. And I think it will encourage me and those around me to actually be more proactive in trying to actually help people. Because if you look at India's problem right now, 60% of all deaths happen because of non-communicable diseases. And when we are talking about diabetes, hypertension, dyslipidemia, cancers, and chronic lung disease, it's obvious that we cannot educate at the undergraduate level every doctor with regards to the management of these issues that we need to know in day-to-day clinical practice. Even in COVID times, these are the comorbidities that have killed most of the people. So I think as a diabetologist and endocrinologist, I have a very important role in dispersion of knowledge. And also, I was listening to one of the speakers talking about creation of models of care, which we can actually then upscale onto a state level and national level. I'm at least happy to let you know that we've already got permission from the state government as well as the central government to start one pediatric diabetes clinic in each district general hospital of the state of West Bengal. We've started it as a pilot of 5 districts, and we are going to scale it up, and hopefully someday all children with diabetes in India, along with the entire healthcare professionals, will get trained to manage diabetes. And once again, thank you very much. It's a pleasure to be acknowledged as a teacher.
Congratulations. In nephrology, the CME Excellence Dronacharya Award is presented to Dr. Jyoti Abraham, Professor of Medicine, Pondicherry Institute of Medical Science, Director Nephrology, Madras Medical Mission, Chennai, and Adjunct Professor, Indian Institute of Technology, Madras, for exceptional CME efforts in nephrology. Heartiest congratulations, Dr. Abraham. I request you to please say a few words.
Distinguished colleagues, Anisha and other distinguished people there, I am humbled and honored by this award. Being a medical teacher from the year 1994, starting in University of Kuwait and then in different parts of the world, I enjoy my teaching. I have my dynamic colleague there sitting, Dr. Narayan Prasad, who is also a dynamic teacher. Since February 2020, we didn't have any platforms to share the knowledge with other people. So we have established platforms through digital method, and at the local level, at the national level, at the region level, and international level. And Dr. Narayana Prasad also did a great job in spreading the knowledge on diabetic kidney disease, hypertension, dialysis, transplantation, and so subjects. And we had debates, we had discussions, we had concerns expressed by the delegates and corrections given to them. So it was a great platform for the last 1.5 years. And I'm extremely thankful to Omnicuris for honoring me with this award. And I'm sure that we will continue and strive to educate more people across the various regions and also internationally. And I'm extremely thankful to you and say that look forward to collaborating with you in future endeavors. Thank you very much.
Congratulations. The CME Excellence Dronacharya Award is presented to Dr. Narayan Prasad, Professor, Department of Nephrology, Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow, and Honorary Secretary, Indian Society of Nephrology for exceptional CME efforts in nephrology. Heartiest congratulations, Dr. Prasad. Please go ahead. I request you to please say a few words.
Yeah, at the outset, I would like to thank Mr. Kamal Narayan, CEO of Integrated Health Wellbeing Council, and Nisha Nair for this recognition and award. As Professor Georgie Abraham sir has rightly pointed out, when we have the pandemic, when I started this pandemic, we had nothing to share. And through your channels, through your programs, CME programs, and through many other programs or through this electronic media, we have disseminated this knowledge. At the time, this was very great challenging for all of us. There are many patients on the dialysis who were dying. There was no scope for getting dialysis in many of the centers. And many of the centers, because of the fear of this COVID, they were refusing dialysis. So we have framed a guideline for the entire country, and then that has been accepted by the government of India. And then this has been implemented across India, and we have prevented so many deaths through that. So that was very challenging for all of us. And being the Secretary of Indian Society of Nephrology at that point of time, it was very challenging for me particularly. Then we have framed a guideline for the treatment of all across, all pupils on immunosuppression, pupils for transplantation, getting the immunosuppressions during these COVID times and this SARS-CoV-2 infection. So this was all very challenging, but we have issued a whole journal supplement on COVID and kidney diseases, and that has helped a lot for entire Indian nephrologists. So, and through this particularly this platform, like your electronic platform through which we have disseminated so many knowledge. We have one panel discussions on this platform. So this was on our part. Congratulations. I would like to congratulate you all, the team of the IHW Council and Omnicuris for excellent endeavor to disseminate the knowledge to the every corner of India. And I think it is one of the most popular platforms and which have connected so many people all together, so many stalwarts. Today I have seen from Nikhil Tandonji to so many great physicians here, and this has given opportunity to connect with one of the mentors, Dr. Georgie Abraham. He is one of the founder of the Tankar Foundations of Chennai. That is a very popular foundations helping out many patients of the kidney disease in many forms. Getting the free of cost dialysis, free of cost immunosuppressions. So thank you, Georgie Abraham sir, for your kind words. I humbly accept these recognitions and thanks a lot again, and expecting more strong association in your futures. Thank you, Omnicuris. Thank you, IHW Council.
Congratulations, Dr. Prasad. The CME Excellence Dronacharya Award is presented to Dr. Yogesh Chhabra, Senior Consultant Nephrologist and Renal Transplant Physician, Max Healthcare, for exceptional CME efforts in nephrology. Please put your hands together to congratulate Dr. Chhabra. Dr. Chhabra, would request you to please say a few words.
Thank you very much. Hello. Thanks a lot. I truly feel very humbled and honored to receive this recognition. And it has been, I would like to thank IHWC as a whole. It has been, an honor for me to receive this award. And this was a thing, because in COVID pandemic, initially we were lost. We were actually trying to struggle with the amount of the patients and their dialysis. I truly agree with my mentors, Dr. Narayan Prasad, Dr. Georgie Abraham. They have been the senior who have guided us throughout this pandemic initially, and guided us in a appropriate way how to handle the patient and how to teach each and everyone, so that we can handle this situation in a more comprehensive way. And this was a very truly a different experience. Although there have been many negative sides of the COVID-19, but this is the positive side, that we have been combined together over such a platform, and we have been able to share our experiences, whether in our field of nephrology or whatever field we are into, and give our experience regarding COVID-19 pandemic and further teaching experiences. And we have learned a lot through all these CME experiences in last 1.5 years. This has been a great experience. I would like to continue ahead with the same teaching program as far as possible. I initially joined as an assistant professor in AIMS, and I worked there as an assistant professor for one unfulfilled. And this platform over the webinars has given me truly a great recognition, a great opportunity to go ahead with this kind of teaching program. I would like to thank again IHWC and the organizing committee for giving me this award. I'm truly honored and humbled to receive this. Thank you very much.
Congratulations, Dr. Savda. The CME Excellence Dronacharya Award is presented to Dr. Vishwanath S., HOD and Consultant, Nephrology, Transplant Physician, Manipal Hospitals, Bangalore, for exceptional CME efforts in nephrology. Congratulations, Dr. Vishwanath.
Thank you.
Thank you so much for being here.
Thank you very much. Thank you very much. At the outset, I was surprised that I was selected for this. In fact, I would like to thank IHWC Council and the organizing committee for selecting me. In fact, we have been involved in teaching since the beginning of my career. We have an active DNB program. I would like to again dedicate this award to my students and registrars and postgraduates who have been the frontline workers in the COVID. In fact, they have been toiling very rigorously since the COVID began last year. So I would like to rededicate this to all the frontline workers who have been at the forefront of COVID in spite of their personal problems, their families, their children, their parents. Still, they have been working, and none of them have shied away from not working in the front line. So thank you very much for again considering me for this award. And it's indeed a great honor to accept this in front of my teachers, Dr. Narayan Prasad, Dr. Georgie, all doyens in nephrology. Thank you once again. Thanks to the organizing committee. Thank you. Namaste.
Congratulations. The CME Excellence Dronacharya Award is presented to Dr. Manish Singla, Senior Consultant and Transplant Physician, Max Super Specialty Hospital, Mohali, for exceptional CME efforts in nephrology. Congratulations, Dr. Singla. I request you to please say a few words to all your peers.
Thank you. Again, I was also amazed when I got an email that I was selected for this award. Once again, I like to say So great thanks to IHW Council and Omnicuris for selecting me for this award. I think I will like to dedicate this to my patients who had been my best teachers throughout my career and has taught me a lot many things going forward. I'm looking to serve my patients in a better manner and learn many more things from them. Definitely in this year, continuous medical education, CMEs have given a lot of opportunity to learn and disseminate the knowledge. I'm hoping it will continue even when the pandemic is over and face meetings start. Even then, the CME efforts will continue, which are really vital. in upgrading our knowledge on a constant basis. Thank you once again.
Congratulations, Dr. Singla. The CME Excellence Dronacharya Award is presented to Dr. Hitesh Gupta, Senior Consultant in Nephrology, Sri Mata Vaishno Devi Narayan Super Speciality Hospital, Jammu, for exceptional CME efforts in nephrology. Please put your hands together to congratulate Dr. Gupta. Dr. Gupta, thank you so much for being here. Please share your vision.
Thank you, Anisha. Good evening, all my colleagues. I would like to thank IHW for this initiative to start the CME so that during the COVID pandemic, being located in a small area like Katra, areas and discuss and disseminate and receive a lot of knowledge. So I'm really honored and privileged to receive this award, and I hope that we will continue this type of events further in future. So that from lot of phones are coming. So I am honored. I thank for this recognition. Thank you.
Congratulations, Dr. Gupta. So Dr. Gupta's phone has already started ringing with congratulatory messages and calls coming in. We'll be able to attend to some of those calls. The CME Excellence Dronacharya Award is presented to Dr. Ritesh R. Varnikar, Associate Professor Nephrology, JN Medical College, Belagavi, for exceptional CME efforts in nephrology. Please congratulate Dr. Varnikar. Dr. Varnikar, please go ahead and share a few words with everyone here.
Good evening, everyone. I am very honored and humbled by ICWS and Omnicuris for selecting me for this award and to put me on the same page as our one of the great nephrologists of India, Dr. Georgie Abraham, with our Vishwanath sir, with Narayan Prasad sir. So I feel very humbled, and it was all of a surprise. Yesterday I got a call from Omnicuris, so I was supposed to be one of the receiving the award for the Dronacharya one. So last 1.5 years of this pandemic, we conducted many virtual CMEs and we continued our transplant programs through proper precautions. And this was a period when we really came to know how the other metro cities or other big cities and other countries, how they are continuing our nephrology practices, and learned many things of nephrology practice in this COVID era through many of our seniors, especially from Bangalore, which is about 500 kilometers from my place. So I'm very humbled to receive this award, and thank you once again, Omnicuris and ICWS. Thanks once again. Thank you.
Congratulations, Dr. Varnikar. The CME Excellence Dronacharya Award is presented to Dr. Uppal Sen Gupta, Senior Consultant, Nephrologist, Fortis Hospital and Kidney Institute, Kolkata, and Associate Professor and In-Charge, KPC Medical College and Hospital, Kolkata, for exceptional CME efforts in nephrology. Heartiest congratulations, Dr. Sen Gupta. I request you to please say a few words. Dr. Sen Gupta here. Okay, I think Dr. Sen Gupta is not here. Let's move on to the next award. The CME Excellence Dronacharya Award is presented to Dr. Vivek Ruhela, Consultant Nephrologist, Kailash Hospital, Dehradun, for his exceptional CME efforts in nephrology. Congratulations, Dr. Ruhela. I would request you to please say a few words.
Thank you, Nisha. Thank you very much. And thank you, Omnicuris, actually. And I'm on the same platform as my teachers are here. I'm very thankful to my stalwart teacher, Dr. Narayan Prasad, and I have been trained under him for almost 4 years. And the habit of teaching actually inculcated by the rounds of the strict round which he took in the PGI, Lucknow. So, I mean, the words are very few to explain the teaching which we have given to whole of our batch. And actually, this habit continues. And I actually joined the medical college here also in the Dehradun to continue this thing. And we are teaching the students of the MBBS and the MD medicine also. And recently, we are going to start our own nephrology department with the DM courses in it. So finally, the things are going well, and I'm thanking you again, the Omnicuris, for selecting me for the CME Excellence Award. Thank you very much.
Congratulations, Dr. Ruhela. We're now going to move on to the dermatology category. The CME Excellence Dronacharya Award is presented to Dr. Sanjeev Kandhari, Consultant Dermatologist, Dr. Kandhari Skin and Dental Clinic, for exceptional CME efforts in dermatology. Heartiest congratulations, Dr. Kandhari. I request you to please say a few words.
Thank you, Anisha, and I thank you for the honor and privilege given to me, and I put on record my gratitude to the ISW Council for considering me. Nothing comes from nothing, nothing ever could. Somewhere in my journey, I must have done something good to have deserved this award. I thank you all for this. CME, I must say, is both for the presenter and the receiver. Well, I've been more on the receiving end while being a presenter, both from my juniors, my colleagues, as well as from the patients, especially the poor patients from whom I've learned a lot. And I really appreciate the pillars on which the ISW stands: good air, water, food, lifestyle. That's really nice, and healthcare for all. I really appreciate it and put on record my appreciation. I thank you for considering me for this award. Thank you very much.
Congratulations, Dr. Kandhari. The CME Excellence Dronacharya Award is presented to Dr. Malvika Kohli, Director, Skin Secrets, Consultant Dermatologist at Jaslok Hospital and Research Center, and Breach Candy Hospital Trust, for exceptional CME efforts in dermatology. Congratulations, Dr. Kohli. I request you to please say a few words.
Thank you very much, the IHW Council and all the members and Omnicuris for this very, very prestigious award. I'm humbled to have been nominated, as well as to be with gratitude to be a recipient of the Dronacharya Excellence Award. I've always believed that learning should be seamless and that teaching should be selfless. This pandemic year brought out that whole passion and gave us a wonderful opportunity to actually create SOPs and guidelines for COVID, for our dermatological procedures, aesthetic procedures, as well as it helped us to standardize so many aspects, and it really gave us a wonderful learning and sharing experience. I'd like to thank not only my senior colleagues, my contemporaries, but also my young colleagues who showed so much interest in all these webinars and CMEs and gave us that thrust and push to continue with them and further the field of dermatology and aesthetic dermatology as well. So thank you very much, and it's with great with gratitude that I accept this award, and I really wish the IHW Council a further greater success in all their endeavors, and would really like to contribute in any way that I can in the coming future. Many thanks.
Congratulations, Dr. Kohli. Next, we move on to urology. The CME Excellence Dronacharya Award is presented to Dr. Ravindra S. Sabnis, Chairman, Department of Urology, Mulchi Bhai Patel Urological Hospital, Nadia, Gujarat, for exceptional CME efforts in urology. Please put your hands together to congratulate Dr. Sabnis. Dr. Sabnis, I request you to please say a few words.
Yeah, many thanks for choosing me for this particular award. And it's a great work that this organization is being doing. I was just listening to the discussion between Dr. Diwakar and Kamal Narayan and understood that the whole holistic approach that you are taking and you are doing all the good job is really commendable. Well, as you rightly say that the CME awards are the one which really stimulate, and Hiralaji also mentioned that the awards not only gives a prestige, but it also stimulates not only you, but the all people around you also get stimulated that something is being appreciated for the good work that you are doing. Well, this CMEs, we have been doing lots of CMEs in urology area. We have been doing, since the COVID time, we are doing a lot of online teaching and so many activities, and all that is being appreciated. And on behalf of the Urological Society of India, I really sincerely thank the organization for choosing me for this particular award. I'm really, really humbled for to get this award, and my pleasure to accept this. Thank you very much.
Congratulations, Dr. Satnis. The CME Excellence Dronacharya Award is presented to Dr. Mahesh Desai, Medical Director, Multibhai Patel Urological Hospital, for exceptional CME efforts in urology. Heartiest congratulations, Dr. Desai. I request you to please say a few words.
Thank you, Anisha. It is indeed a pleasure and a privilege to get this award, and 2 awards to our institute. 2 awards to our institute. Dr. Sabnis is my colleague, and I feel that this is a very important subject where you must train the next generation for the future of the medicine. And we found that the 21st century, even the knowledge is same, but the skill development has changed. And from open surgery to a minimal invasive surgery. And we at Multibhai Patel Urology Hospital has taken a lead in developing the skill lab, where we get our own doctors and the doctors from all over India and abroad coming to learn different technique of laparoscopy and robotic surgery. I had a privilege to be a president of the Society International Urology. It's an international organization, and World Endourology Society, beside being a president of the Indian Urology Society. And I feel the responsibility lies on us to train the next generation, give them opportunity to make them excellence. And I feel really proud that our students are picked up very well. At a young age, they pick up well and they do well. And actually, I would like to dedicate this award to my students who have been have grown to be excellent in their field. Again, thank you very much for giving this award. I'm very grateful to the organization. Thank you. Thank you.
Congratulations, Dr. Desai. Now we're going to move on to ophthalmology. The CME Excellence Dronacharya Award is presented to Dr. S. Natarajan, Chairman and Managing Director, Head and Consultant, Vitreoretinal Surgery Ophthalmology, Aditya Jyot Eye Hospital, for exceptional CME efforts in ophthalmology. Congratulations, Dr. Natarajan. I request you to please say a few words.
Thank you very much, and thanks to the Omnicuris and IHW. I just read about on IHW about multilateral stakeholder and R&D in training, health communication, publication, and education. And I'm happy that I work with Omnicuris closely. And Omnicuris did a wonderful program. Before that, I want to tell about IHW. The reason is I believe in 100% patient satisfaction, education, and also to create awareness. Even though I'm a surgeon, vitreoretinal surgeon, but I wanted to prevent diabetic blind from India. So I'm making a program called Diabetic Blind Free India 2025 as an All India Ophthalmic Society past president, as well as I'm the president of Tele-Ophthalmic Society of India. And the idea is we want to reach all the villages, use offline artificial intelligence using the mobile phone. You can take a photograph of retina, and an ophthalmologist or an image grader sitting in Aditya Jyot or anywhere, or even a non-medical person can take this phone. That's what we have done training in all the slums of Mumbai. We have a MOU with the Bombay Municipal Corporation, MCGM, Municipal Corporation of Greater Mumbai. The idea is to screen every diabetic. So there's a special program specifically done by Omnicuris, and I'm also working with Omnicuris from my All India Ophthalmic Society President days, where they are a CME partner for All India Ophthalmic Society, and we are the largest ophthalmic society of the world with 23,000 members, and Omnicuris is an official CME partner. But Omnicuris made a special program with me. Omnicuris, this is what I write to all my best faculty in the world, not only India. Omnicuris, India's largest online platform for doctors in collaboration with various state medical councils, has launched its first ever talk show for the ophthalmology fraternity, and exclusive on air with Dr. S. Natarajan, our ophthalmology air show. And I wanted this to be a novel, interactive, informal chat show which makes learning more interesting and fun. And that way, we were in the middle of COVID, and I think every day I had 3 webinars all over the world. Thanks, I can see Soumya is laughing away to glory, because she's the one who is really a most energetic person of Omnicuris. And I actually asked her, how does your the owner or the promoter of Omnicuris is looking after you? And I can see her 32 teeth now. Thank you. And I understand that the usual webinar format has become quite tiresome and boring for many people, and hence the conception of this one-of-a-kind multi-episode where I will have the pleasure of being the host and interacting with young, distinguished ophthalmologists of today. The most unique aspect of this show is that it's being conducted by Omnicuris, an online platform which assigns CME credit points for this talk show, which is great. We had a 1 CME credit. And we had started, and the important thing is anybody cannot log in. Like now we have FB Live, anybody can see. But this show, you have to be an ophthalmologist and you have to register, and you have to register, then only get in. And I think we aimed at 1,000 plus, and I'm amazed. Every time we had 1,000 plus attending and online. And apart from that, they have there in the YouTube. And we had started the first show of the series with a session on recent advances in ophthalmology on October 2nd, 2020, on Gandhi Jayanti. With our long-standing friendship, I'm very pleased to invite all the top ophthalmologists of the world. We did 1 Indian, and every 2 weeks one for foreign faculty. I can think of this is what we wrote, and the format of the show is that of a short video. That means we add 10 case presentations as a video and PowerPoint slide presentation, but I never encourage slide except Dr. Subba Ruang somehow said he cannot show video, but he showed but excellent slides on genetic engineering in ophthalmology. And at the end, there was a question answer of with the audience, and a final rapid fire session, which viewers get to know the speaker. And it was nice because I always imagined like a coffee with Karan, and here I actually wanted coffee with Soumya, but she made me a host, and I'm glad. Otherwise, I usually give the bhashan and people listen, but here I listen to them, I question them. In that way, Soumya made me do homework on 15 branches of ophthalmology. That means ocular oncology, oculoplasty, the dry eye, ocular surface disorder, and so on. And I think we had 15 subspecialties, and I enjoyed doing this. And I actually called her 2 weeks back, and I said, when are we starting again? Because the regular webinars are boring. And I think, I'm sure everybody, I even have a specific exercise, because all the time you sit down and your back muscles pain. So I don't have muscles also. That's my problem. So I'm now doing exercise to improve my back muscles so that I can sit and do it. And I have created a studio in the hospital. I invite IHW to be a partner, and also Omnicuris. And really, Soumya, I made a Aditya studio to make a lot of teaching videos, teaching snippets for the postgraduates, and also motivational talks. Thanks to my daughter who has made it with a professional camera. And then also maybe I learned from my life coach, Dr. Anamika, that you should even charge for the video. Maybe we'll partner with Soumya and make some CME credits. Once again, thank you very much for the Dronacharya Award. And I always dedicate my award to my mentor, that is Dr. Badrinath Padma Bhushan. I always salute my Mata, Pita, Guru, Mitra, and Deva. And without audience, what is the use of teaching? That means without students, no teachers. Without patients, we are not doctors. So I think IHW is an excellent platform, and an excellent platform for Omnicuris. And I congratulate both IHW. I can see Kamal Narayan sir is clapping. Thank you very much, sir.
Dr. Natarajan, thank you so much. You are a recipient of many, many awards, including the prestigious Padma Award. And seeing your enthusiasm in teaching, as well as bringing in newer, innovative formats to online learning, we've at Omnicuris really enjoyed the journey with you in the field of ophthalmology. And we're looking at touching, I guess we've already touched over 20,000 ophthalmologists in the country, and we are looking at doing more with you as well as the society in the near future. So congratulations again. Keep innovating, keep guiding us with all your knowledge and expertise. Thank you so much.
Well, I would like to come and do in-person meeting in Bangalore.
Absolutely, doctor. Any day. Thank you.
Thank you. Thank you, Soumya. The award goes to you, actually. Soumya was actually a taskmaster. She was actually having a cane and beating me.
Dr. Natarajan, congratulations. I really like your enthusiasm for doing CME in such an innovative way.
So I have a name called 4G Natarajan to 3E Natarajan. 4E Natarajan. The 3G is for third generation ophthalmologists and good genes and all the latest generation of technology I use in ophthalmology and my phone. And 4E stands for energy, enthusiasm, efficiency, and last eating chilies and endorphins. Thank you.
Audio coming, I'm just wondering. Yes, we're going to now move ahead and go to the Dronacharya Awards for Pulmonology. The CME Excellence Dronacharya Award is presented to Dr. Raja Dhar, Director and HOD Pulmonology, CMRI Kolkata, for exceptional CME efforts in pulmonology. Congratulations, Dr. Dhar. I request you to please say a few words.
Thank you very much, Anisha. Much obliged. Obliged to IHW and to Omnicuris for this award. Unlike Dr. Natarajan, I think we have just started working with Omnicuris. And I think while there have been very many minuses of this COVID pandemic, it's also helped us to innovate and learn new ways of delivering teaching, including CME teaching. And we have come up with an online platform and learned how to teach in various innovative ways, which Dr. Natarajan spoke about in great detail. How to deliver teaching which is interesting, even though there is a degree of monotony about teaching on a virtual platform. And we've now come up with hybrid platforms. Hopefully going forward, there'll be teaching of hands-on skills, which will happen on a hybrid platform with lecture-based teaching on a virtual platform and then hands-on teaching in person for areas where this is needed. So I wear another hat, which is as the Academic Secretary of the Indian Chest Society. We've got a Training Education Initiatives Committee. And as a part of that, I think the training of postgraduate and undergraduate and young pulmonologists is something that we have focused on. As Indian Chest Society, we have done more than 100 webinars during this period. And now we are doing hybrid courses, which we are developing. We have and we will continue to seek the help of Omnicuris in this. I am obliged to IHW for giving me this award. It's a big accolade and it will give me impetus to work harder and develop CME teaching in this country going forward. So thank you very much to all of you and congratulations to all other winners.
Congratulations, Dr. Dhar. And heartiest congratulations to all the winners of the day today. I would now like to request Kamal Narayan, CEO of IHW Council, to give his closing remarks. Kamal, over 3 days, you've heard so many doctors, and it's really an eye-opener on the amount of work doctors are doing for continuing medical education.
Thank you so much, Anisa. It was a wonderful evening, and I could see the enthusiasm and so much of efforts which are, these experts and doctors have put in for the betterment of healthcare services in our country. And we are very humbled and honored ourselves for, recognizing your great work. And as Savita had also initially mentioned that in front of your seminal work and efforts. These recognitions are very small, but at the same time, they are a token to, kind of celebrate the good work which has been done. And also the best part that through these platforms and awards, we have also been able to bring together the, kind of multi-generation of doctors and experts and teachers. I can see at least 3 generations of nephrologists sitting here. So it's a great achievement and honor for us also. And we believe that, they are all equal in terms of when it comes to their effort towards making India a healthier nation. And we truly appreciate that. And thank you so much. With this, we are concluding our 5 months long effort, and we look forward to have the next edition of it next year. And we look forward to see so many new Dronacharyas joining the league with their efforts towards disseminating knowledge, improving health of the people, and improving the health of our country. Thank you so much, and congratulations. And very, very deep gratitude to all of the awardees today and the guests who joined us. Thank you so much. And thank you so much. Thank you, Hiralalji, for sparing time. All our awardees who stayed with us all through the ceremony. Thank you so much. Thank you, Savita Kuttanji, for her continued support and helping us put together this whole initiative. We began well, we are moving better, and I'm sure we are going to continue doing much better in the future as well. Thank you so much to the entire team of Omnicuris and also the ISW Council team, which has been tirelessly working behind this and ensuring that we have a seamless celebration of this good work. Thank you, and a very, very good evening, and a great year ahead. Till the time we meet again for these Dronachar and CME Excellence Awards. Thank you so much.
Thank you, Kamal. I would now like to invite Soumya Jayakrishnan of Omnicuris to say a few words during the closing of this very long effort. We've already heard about Soumya from Dr. Natarajan. So, Soumya, let's hear it from you as well.
Thank you very much, Anisha. Good evening to all. Respected awardees, dignitaries, and my fellow audience, this is indeed a massive celebration of CME Excellence movement. Omnicuris continues to strive to recognize the contribution and excellent work done by the doctors in various therapy areas for the effective healthcare delivery. We're extremely proud to see the most deserving doctors from the corners of India being felicitated here today. A round of applause and heartiest congratulations to all the award winners. Have a great evening. Thank you.
Congratulations to all the award winners. Keep up the great work that you're already doing. There are many millions of people who are benefiting from your work. Thank you all for joining us, and goodbye.